Hello everyone, this is Dr. Vinayak Jyoti from Healing Hands Advanced Physiotherapy Clinic. This is the first episode of Ask Dr. Vinayak. Hope you are all doing well. Here I am going to answer all your questions related to health and physiotherapy. So let's get started with the questions. First question is from Mrs. Rashmi. I have been doing back exercises for too long now and I still feel that it's weak. What shall I do? If you have been doing your exercises and still not getting the results, then we need to reconsider and modify the exercises so that we can engage muscles better for strengthening and control. The second question is by Mr. Naveen. He asks, Hi Dr. Vinayak, is it okay to exercise even if we have pain? That's a very nice question. A lot of people ask about that. In general, it is not okay to do exercises when you have any sharp pain or too much pain while doing exercises. Whereas in rehabilitation, we let our patients do exercises with mild to moderate pain under observation. Hope it answers your question. The next question is by Mr. Vikash and it is also asked by Mrs. Maitreyi, the similar question. Doctor, is there any way to reduce fat without exercising? That's a very nice question. A lot of people are asking these questions nowadays. Maybe they don't want to exercise. Yes, there are ways to reduce fat and lose weight without exercising much. Though exercising would give you a better result. I think I should make a dedicated video on this topic and I'll be posting it soon. So stay tuned for that. So the next question is from Mrs. Annapoorna. She's my old patient. Hello Dr. Vinayak. I have knee pain. Should I avoid climbing stairs? With mild knee pain, it is okay to climb a couple of stairs slowly. If climbing stair doesn't aggravate your pain, only then. Whereas when you have moderate to severe knee pain, you should always consider visiting your physiotherapist and take advice based on your specific condition. Your physiotherapist can advise you according to the level of injury and whether you will be able to climb stairs or not, whether it is safe for you or not. The next question is from Mr. Jagadeesh. He asks, what should I wear to my first appointment? Okay, yes. A lot of people come to me when they are coming to the first consultation or the first visit with tight shorts or tight jackets and all those things. It is always better that you wear something comfortable. Bring a pair of shorts or loose pants. If it is a lower back pain, hip pain, knee, ankle or a foot problem, bring a loose t-shirt or vest if it is a neck, upper back, shoulder, elbow or hand problems, so that you can expose the treatment part appropriately and the treatment can go smoothly. Hope it answers your questions. Next question is by Mr. Vivek Kumar. Is it mandatory to see an orthopedician before consulting physiotherapist? That's a very good question, Mr. Vivek. A lot of people still think that they should come to a physiotherapist only after a referral from another doctor. But the answer is no. It's not mandatory to visit any doctor to see a physiotherapist. Physiotherapists are qualified enough to assess, diagnose, and treat any injury or condition. And yes, we do sometimes refer you to a specific doctor in case we see a need. The next question is by Miss Lakshitha Jain. She asks, Hi doctor, could you please suggest some exercise to improve the overall flow in the body? Work from home is taking a toll on mental and physical health. That's a nice question, Ms. Lakshita. I have already posted a video on work from home ergonomics and I'll be posting a dedicated video on exercises to do to improve posture and blood flow to protect your health while you're working from home. So stay tuned for that. Next question is by Mr. Srinivas V. He asks, while playing badminton, I have sharp pain in my shoulder, especially while taking tricky shots. But it reduces after taking little rest. What shall I do? Do I need to worry about it? Your question is very specific and you might require immediate attention. It could be a simple muscle strain which might lead to a rotator cuff tear if neglected. So you should definitely see a physiotherapist soon. Physiotherapists can release your muscles and restore functional mobility along with sports-specific strength training so that you can recover completely and can start playing again safely. The next question is from Mr. Suraj HR. He asks, what caused my pain or injury and what can I do to stop it from happening again? Mr. Suraj, as your physio establishes a diagnosis, they will also explain what caused your pain or injury based on the assessment performed. When the diagnosis and contributing factors to the condition have been established, a plan not just for your recovery from your pain, but they will also address the contributing factors to decrease the risk of injury happening again. Hope it answers your question. Next question is from Miss Sudha. How long will it take to get better? This is a very vague question. How long will it, because I don't know about your condition, I don't know about your injuries, but I have to answer. Depending on the extent of the injury, how long it's been, and your consistent efforts and right rehabilitation program, it takes time to get better. However, we can only tell the approximate time that you would be taking after doing a thorough assessment of your condition. Consistency with treatment plan and compliance with home exercise programs will accelerate the recovery time though. Next question is coming from Mr. Niranjan. What can I do to assist my recovery? Consistency is the key. With treatment and committing to the exercises prescribed, you can help speed up the whole process. Adhering to exercises and advices we give on work ergonomics, posture corrections, and other activities is also very, very important. Apart from these, staying hydrated and taking care of your nutrition to get the maximum benefit from the rehab program. Next question is coming from Miss Priya. Should I take complete rest and avoid working for a few days if I have low back and neck pain, or shall I keep doing it? Please throw some light on this. Ms. Priya, that depends completely on your injury. For example, those days are gone when bed rest was recommended for a simple back pain. Continuing light activities and respecting your pain without being fearful of it is very, very important. We will tell you what are the things that you have to stop, what are the things that you have to modify, and what are the things that you need to incorporate in your daily activities according to your specific condition or injuries. Thank you. Next question is by Mr. Sujay. He asks, do I have to stop training or going to the gym if I have pain? Very nice question, Mr. Sujay. A lot of people have fear of going to the gym when they are in pain. It is not necessarily that you have to stop going to the gym when you are having a pain. It is more important to modify your training. Work and gym sessions, you don't need to stop altogether. Although it can completely depend on the kind of injury you have. We will tell you what is the appropriate and what is not appropriate and educate you about your condition so that you can take better decisions while working out. Hope it answers your question, Mr. Sujay. Next question is from Mr. Nagaraj. He asks, can I contact you in between sessions if I have any questions? Absolutely. If you have any concerns about anything that we discussed, or if you have any questions in regard to the exercises shown, we will be happy to address those issues in between the sessions. Just come to any of our 3 branches which is there in JP Nagar, Jayanagar and BTM and ask us. You can also call us at 8884447808 for talking to us directly. I hope all your queries are answered. If not, head on to social media platforms or put your queries in the comment section below. Thank you for taking your time and asking those questions. You can put your questions for the next episode of Ask Dr. Vinayak by writing it with hashtag AskDoctorVinayak, and I will be more than happy to answer your questions. Thank you so much.